When applying the standard taping for the Achilles tendon, start with a thin layer of pre-wrap around the ankle and foot. Better adherence of the tape and overall stability of the tape job can be enhanced if a few strips of tape are applied directly to the skin, in this case, mid-calf. 3 anchor strips would be a minimum around the leg for an Achilles taping. You should overlap half the width of the tape as you apply it to avoid holes in the tape job. Anchor strips should start at the base of the belly of the gastrocnemius muscle. Note that anchor strips around the top of the calf are angled as they go on the leg to accommodate for the cone-like tapered shape of the calf. The nearer you get to the ankle, the less the need for those angles, as the distal tibia and fibula are more cylindrical. Anchor strips on the foot should then be applied. A minimum of 1 to 2 anchor strips should be placed on the proximal foot, but more may be necessary for the larger patient. Once the anchors are set, the patient can be moved to a prone position for better visualization of the Achilles. Determining how much to restrict dorsiflexion of the ankle can require some trial and error. Now, with the patient prone, you can lay the non-adhesive side of the tape down on the patient's leg to measure for the proper length of strip needed that will run from the sole of the foot to the base of the belly of the gastroc. Once the length is determined, you can lay more strips down on the first strip, forming an X first, and then a bit of an asterisk with subsequent strips. You would like the intersection of the strips to be about 2/3 of the way down the length of the first strip. The smaller portion, the 1/3 length, would go on the foot, while the longer 2/3 will run up the Achilles to the gastroc. Position the ankle in a slight amount of plantar flexion and fix that smaller portion of the strips to the foot with a strip or two in a similar position as your initial foot anchors. Double checking the ankle position, fix the longer end of the strips to the leg. If there's an excess of strip running up the leg, no problem. Simply fold the excess down, trapping it in your final leg closure strips.